Hi, it's Dr. Arif Rajpura, Director of Public Health at Blackpool Council here again. Again, wanted to give you an update this week on the pandemic and where we are with the coronavirus pandemic. Again, I'm pleased to report that over the last 7 days, we've still got single-figure numbers of positive cases in the town. So that's really positive, and thank you to everyone that's following the guidance and keeping these figures low. I think it's important that we all continue to follow that guidance around social distancing, wearing face coverings where they're required, hand washing, and also the advice on catch it, bin it, kill it. So a big thank you to everyone, big thank you to the people of Blackpool, but also a big thank you to all the businesses that have complied with the COVID secure guidance. Let's keep the rates low. It's been a week now since the face covering advice came in, and I think it's important that we all continue to follow that guidance so that we can keep everyone safe. In terms of our local situation, our local plans, as we see lower levels of community transmission out there, we may see pockets of hotspots or outbreaks. If that does happen, we do have our outbreak management hub in place, and we're fully resourced and ready to go if and when that's required. I'm pleased to say at this moment in time we haven't had to deal with any outbreaks, so that's really positive news. But of course, if we do get an outbreak, the key thing is not to be alarmed, and that we have got plans in place to deal with any particular hotspots, wherever that is. If it's within a workplace or another setting, we'll try and make sure that we deal with it. And what I want to do is prevent any further spread out into the community from that outbreak as well. What everyone needs to do is make sure that if they are going into a restaurant or any other place where you're being asked for your details, please share your details so that if anything does happen, in case we get a positive case in that setting, then the NHS test, track and trace system can kick in and do the appropriate contact tracing with the contacts that are available. Also, just planning ahead and planning for the future and planning into winter. What you will have seen with the pandemic thus far is that people that have got underlying health conditions, the elderly, those individuals have been affected the most in terms of severe COVID illness. And what we need to do as we prepare for winter is get everyone fit and healthy as far as we can. So if you've got asthma or if you've got diabetes, please get your condition under control, fully under control, and in an optimal position, so that as we go into winter, if we do get another surge during the winter months, that people are in the best physical condition to fight COVID. Stopping smoking, losing weight, of course, really important measures. So please, let's get fit and healthy as we go into this next phase. You will see a big push for flu vaccines as well as we go into the winter months. And it's important that those people that are eligible for a flu vaccine do get the flu vaccine, because we don't want the additional pressures of flu on top of COVID as we go into the winter months. So it just leaves me to say, the virus hasn't gone away. We've done really well to get to the point where we've got very low numbers of cases. What I want your support on is, please continue to socially distance, keep 2 meters away from other people, particularly when you're out and about and in shops and other venues. Make sure you're washing your hands, or if you can't wash your hands, you're using the alcohol sanitizers that are available. Please make sure that you're using face coverings in those places that are requiring face coverings. So, if you're on transport or in supermarkets, it's important that you use a face covering. And of course, catch it, bin it, kill it, making sure we're catching coughs and sneezes in a safe way. So thank you again for listening, and I'll see you on the next update. Thank you very much.